Now let's talk about our fourth biomarker, which is predictive biomarkers. And that will help you identify or predict the risks whether you will develop that particular disease or not, and also whether how better or worse you'll respond to a particular treatment. And these biomarkers are valuable for identifying the future health risk and treatment responses. By identifying these biomarkers, healthcare providers can obviously tailor preventative measures and therapies to suit your individual needs and enhancing the effectiveness of treatments and potentially preventing disease progression. So let's talk about predictive biomarkers for cancer risk. So, predictive biomarkers are particularly useful in assessing cancer risks, including gastrointestinal cancers such as colorectal or pancreatic. So, two categories of biomarkers measured are BRCA1 and BRCA2 gene mutations. That's one category. And second category is APC gene mutations. So, BRCA1 and BRCA2 gene mutations are measured through genetic testing. A blood or saliva samples is collected and analyzed for mutations in these genes. And APC gene mutations are also measured through genetic testing. A blood sample is collected and analyzed to detect mutations in APC gene associated with the familial adenomatous polyposis FAP and increased risk of colorectal cancer. So BRCA1 and BRCA2 gene mutations. So presence of these mutations indicate at a higher risk for certain cancers, including breast, ovarian, and also pancreatic cancer. And APC gene mutations. Presence of mutations in APC gene indicate high risk for colorectal cancer and potential development of polyps in the colon. And obviously, when we do this genetic testing, the positive signal is that the absence of these genes. And identifying these mutations allows for target preventative measures such as increased surveillance, lifestyle changes, and potentially prophylactic treatments. And the best case scenario is absence of these mutations reduces the likelihood of developing these cancers, but obviously regular and monitoring remain essential, especially if you have the family history of cancers. One important note I want to add is so these genetic testing for conditions like BRCA mutations may not be routinely recommended for everyone. So it's important to consult with healthcare professional for personalized guidance. And normally these tests are start from very basic and you can't identify the root causes, then progressively more and more complex causes are tested. And obviously if you have gone through all of these simple tests and the root cause is not identified to rule out cancer, obviously these tests can be done and you can ask for it, advocate for it. And remember in last episode I talked about use the magical word medical necessity, and request your provider also to use it. That will help you get the treatment necessary. This is a suggestion, not a medical advice. So let's talk about predictive biomarkers for other gastrointestinal disorders such as IBD and IBS. So two categories of biomarkers measured are NOD2 gene mutations, and second one is serologic markers like anti-Saccharomyces cerevisiae antibodies, ASCA. So the NOD2 gene mutations are measured through, again, genetic testing, through blood sample is taken. And second, for ASCA is measured through blood test. Again, blood sample is drawn. So presence of NOD2 gene mutation indicates that higher risk for Crohn's disease, and presence of antibodies suggests the presence of ASCA antibodies suggest increased risk for Crohn's disease and can help differentiate it from ulcerative colitis. And obviously, the best case scenario is absence of these mutations. And if there are identifying these biomarkers allows for early intervention and targeted monitoring, potentially preventing disease progression and managing symptoms more effectively. And absence of markers reduces the likelihood of developing these conditions but does not eliminate the need for regular checkups and monitoring. Now, let's talk about predictive biomarkers for treatment response. So, predictive biomarkers can also forecast how well you might respond to a specific treatments, guiding a personalized therapy plans. So, two biomarkers measured are UZT1A1 gene polymorphism. Second, thiopurine methyltransferase TPMT enzyme activity. So UZT1A1 gene polymorphisms are measured through, again, genetic testing. A blood sample is collected and analyzed to detect polymorphisms in the UZT1A1 gene, which affect drug metabolism. And TPMT enzyme activity is measured through blood test. Again, the blood sample is drawn and analyzed to determine the activity of TPMT enzyme, which is involved in metabolism of thiopurine drugs used in IBD treatment. So, UZT1A1 gene polymorphism can predict the risk of adverse reaction to drugs like irinotecan used in cancer treatment, and TPMT enzyme activity. Low TPMT activity indicates a higher risk of toxicity from thiopurine drugs, requiring dose adjustments or alternative treatments. And the positive signals we are looking for are we got to identify these biomarkers that allows for personalized treatment plans and optimizing drug efficacy and minimizing adverse effects. So absence of these polymorphism or normal enzyme activities suggests standard dosing regimens can be safely followed. So again, these predictive biomarkers are powerful tool for personalized medicine. They can help identify risk and guide treatment decisions, ensuring that therapies are tailored to each individual's unique genetic and biological makeup.